I get asked a lot of questions about herniated discs. If I can describe the difference. And the easiest thing I could do is draw you a picture and kind of explain, and then maybe explain a little bit about what decompression does also. So first, we have a healthy disc, and it kind of looks like a bullseye. It has rings of cartilage. In the middle, you have almost like a little circle of gel, nucleus. If we have a disc bulge, which I'm sure you've all heard of, we have the disc, we have the rings, and then that nucleus actually pushes and creates a bulge on the outside of the disc. That would put pressure on your nerve. That would cause a lot of pain. The next step, or worst case scenario, is that same nucleus of gel herniates all the way out where it actually breaks through. And it's not a bulge anymore, it's a herniation. The worst case scenario is when that gel not only breaks through and creates a herniation, but it actually fragments out and can actually get caught up on the nerves and create severe neurological problems. Some people will actually have loss of bowel and bladder continence. Some people will have drop foot. There's all types of more serious conditions here. This is surgical, almost always. This is usually surgical, but can sometimes be scarred over and fixed. Bulges usually can be treated and healed without pain. And if there is a problem, both of these can also use a minimally invasive procedure, which would be done by a surgeon. Obviously, and this is your healthy disc. If you look at it on a picture with your vertebrae, and here's another vertebrae, nice healthy disc should kind of look like that. When you have compression of the vertebrae, you may have some of that disc bulge out to the side, where it would put pressure on the nerve. All these scenarios, just looking at it from a different angle. Now, the question a lot of people ask is, how does decompression or traction help this? How does that make that go away? Well, what happens when you traction, you take these vertebrae and they get pulled further apart temporarily. And that creates a negative pressure which pulls it in. If you could ever imagine actually taking like a water balloon, say you glued it to a board and squished it and pulled it apart, it would suck in the middle like an hourglass. That creates a negative pressure, which would, if there was a bulge here, it would help pull it in. And repeating that, the whole goal is to have that bulge or that herniation be drawn in and reduced as much as possible so that it can heal and scar over without putting pressure on the nerve roots.